WGN investigates the cost of just in case. Makeshift hospitals have been built in the city and suburbs. Most haven't seen a single patient.
WGN investigates. Ben Bradley has the price tag, which continues to grow.
They will be building out to 3,000 beds before the end of the month. This, folks, this is Illinois.
In the nearly 1 month since those words were spoken, the makeshift hospital at McCormick Place has seen just 29 COVID patients. Most, if not all, were in relatively good shape as they recovered and prepared to go home. In early April, officials acknowledged the facility may not be needed.
We all fervently hope that we will never need to take care of a patient here.
Of the 254 medical workers the state contracted to hire for McCormick Place, 170 have already been reassigned. But the state health department says there are still 84 assigned to the convention center, which now has just 9 patients. That's 9 medical workers for every 1 patient.
We have a shortage of healthcare workers across the state, so those that aren't working at McCormick that we can redeploy, we are redeploying.
What's it cost? WGN Investigates reviewed state payments and found at least $7.4 million has been spent on medical staffing specifically for McCormick Place. Records reveal the state also bought 800 iPhones for use at McCormick Place at a cost of more than $460,000. While the Army Corps of Engineers played a role in building out some of the so-called alternate care facilities, the bills have yet to come in from private contractors. The state renovated shuttered hospitals in Elgin, Melrose Park, and Blue Island, fearing an influx of COVID patients would overwhelm hospitals. None of the suburban facilities have treated a single person. Susan Swart is with the American Nurses Association of Illinois.
And maybe we wouldn't have had to have spent it if, in fact, we had invested in public health infrastructure over the years. It is something that we're going to have to, as a state, really look at and assess as we move out of this pandemic, because I think that we have found ourselves having to invest very quickly, which always costs more money, to put things in place that if we had been prepared, we wouldn't have needed to expend that extra money.
With Illinoisans slowing the spread by staying home, Governor Pritzker is now saying the makeshift hospitals may not be needed.
It looks like we're going to have the ability to stand down much more of that facility. But again, I don't want to speak too soon, because all of these identified alternate care facilities need to be in a state of some kind of readiness in the event that there's a surge.
At the beginning of this outbreak, the governor foreshadowed that if the state did everything right, people would look back on the construction of these makeshift hospitals and say it was an overreaction. While they've barely been used, Pritzker said he's not ready to say the worst is over and that those overflow hospitals can be shut down. Ben Bradley, WGN Investigates.